Good morning, everybody. I'm Jenny Matthews, and I wanted to talk today about pandas and pans. This was a question that came up from somebody when I was at my OCD training this past weekend at Rogers Behavioral Health, and I apologize, I did not post as much as I wanted to about my training and things I was learning. I underestimated just how busy and tired I was going to be. So I'm still going to be posting some things, it's just going to be a little bit later than anticipated. So wanted to just first start with the pandas and pans question because this was talked about not in as much detail as I would have hoped, but still I've been able to get some good information that I can share. And I'm definitely not an expert in this. I've only treated very few cases of this. And I'm just kind of really learning about it myself. So I'll share what I know, and I'm going to try to keep it brief too, but know that there's a lot more to learn here from what I'll share. So, and there's a lot of great resources available, which I'll share. The pandasnetwork.org is a really good place to go to get some information about this as well. So first of all, I just want to start with talking about what is PANDAS and PANS. For those of you who don't know, PANDAS is, it's a really hard one to remember. So it's the pediatric autoimmune neuropsychiatric disorders that are associated with streptococcal infections. Huge mouthful. Ultimately, a strep infection that is causing some really debilitating symptoms in a child pre-puberty. So you would see, OCD, tics, high anxiety, sensory difficulties, decline in math and writing. And these are considered things that happen very suddenly. So this is not a condition that you would see that has happened over time. So if you're a therapist and you're assessing if this is OCD or PANDAS or PANS, I'll talk about PANS in a minute. One of the biggest things to pay attention to is when this occurred, or what is what was the onset. A parent will tell you that it was literally an overnight change in their child, from normal functioning child to severely debilitated in conjunction with a strep infection. So with that being said, PANS is similar to PANDAS, but there's a couple of differences. PANS is they've kind of extended it to be beyond that pre-puberty stage, and looks beyond just strep. So they've been finding that there were so many cases reported of very similar kind of onset and issues with children that happen at different ages and associated with other medical infections. And so that's why they created PANS. So again, sudden onset, very much a parent will be able to tell you almost the exact date that this change occurred. So in assessing, that's really important to really look at the timeline. And then when it comes to treatment, the important piece here is that this is is a big team approach here. So you need a therapist, you need a psychiatrist, and then you need a medical team for this family too. Because this is a medical condition that's causing a psychiatric condition, the medical symptoms need to be treated. And there is no specific test that says, yep, you are positive for PANDAS or PANS. It is like a diagnostic interview with a clinician. It is a full medical workup with tons of different labs and tests. And so it really is not a very black or white kind of assessment process to get a diagnosis. So it takes a lot of work. And this, rightfully so, creates a lot of stress for families. They come in crisis, and the first stage is really the hardest. And I think if you're working with a family like this, it's really important to help them see that they're in the toughest spot right now as they're getting their team together to help their family and help their child. Once they get that established and start to go, it's gonna just get easier from there. So I can think that can just be really reassuring to families that this beginning part's just the hardest, because they're just trying to figure it all out, kind of figure out what is this, who do I go to, what's the treatment protocol looking like. So I think that can be really helpful for families to know, and then for them also to just get that psychoeducation about what this condition is. And the treatment protocol on the therapist end is the same as it is for OCD. The first line of treatment recommended is using CBT with exposure and response prevention. So this is helping a child to overcome, face their fears in a graduated manner. So it's a very behavioral approach. And so if this isn't your style as a therapist or something you're trained in or comfortable in, you want to refer out. And if you're needing help with that, the International OCD Foundation has a website of therapists that they vet. They have kind of a very small directory of therapists in the area who have gone through their trainings, and that was the training that I was just at. So you can use that as a resource if you're feeling like this is just not something I feel like I can treat. There's a really good resource there for you to find therapists that are good for that. And of course, our P3 community is very helpful in that as well. So you can always reach out and find out, but I think you have to be comfortable doing CBT and ERP, because that's really the recommended treatment approach. And that requires a lot of family involvement. It can't just be an individual treatment for the child, which for most of us who treat kids, that you have to treat the whole family as well, but the parents have to really be involved in that process, because there's oftentimes a lot of accommodating, there's a lot of behavioral issues, and the parents need to be in an active approach with that as well. Okay. I feel like I went through that really fast. I don't know if that was helpful. I hope it was. If there's specific questions about it, please let me know. I'm happy to provide more information. Like I said, in the link, I will include the PANDAS network for you to seek more information. And then I'll also send a link about the International OCD Foundation. Both of those are really, really helpful resources. So let me know if I can be of help with anything else. Yeah. Have a good day, everyone. Bye-bye.